Good afternoon, everyone. Welcome to Driving Cost Efficiency Through AI. My name is Melody. I'm a global business manager for Wipro Healthcare sector. Over the past decade, I work in clinical pathology for several healthcare systems. And during COVID, when we work as a skeleton crew, and also having the experience fast growing of AI and technology, I see many of my coworkers struggling to adapt new technologies. And I realized how important it is to bridge that gap between technology and healthcare. So I decided to join Wipro and help building this support system for our healthcare industry. I'm thrilled to be your host today, and a few housekeeping items before we start. We would love this to be a very engaging discussion sessions. If you have any questions, please just raise your hand or leave a message in the chat. We will also open up for a Q&A session at the end of the session. And also, this webinar's recording and slides will be distributed post-webinar. So let's dive in with our expert, Liviu and Janine. Thank you both for being here today. Now I'll pass the torch to Liviu. Liviu, you're on mute.
Of course, every time it happens. Thank you, Melody. I'm Liviu Imbir. I'm the Associate Vice President of Business Process Services at Wipro. I bring over 25 years of experience in healthcare revenue cycle management, and I've been working across hospital and medical groups and academic health systems for many years. I had the opportunity to be in RCM space during the deployment of HIPAA and PHI standards. That tells you how far back in revenue cycle I'm going. And I've been a first-hand witness to the transformation of revenue cycle operation ever since. At Wipro, I help provider organizations modernize their RCM strategy using AI, automation, digital tools to drive performance, compliance, and also patient-centered outcomes.
Thank you, Liviu. I'm so happy to be presenting this with you. Everyone, my name is Janine Pratt. Thank you for sharing your lunchtime with us. I'm a general manager in Wipro's health sector. I serve as a domain expert and lead our go-to-market strategy for providers in the U.S. I too have 25 years of experience in the healthcare industry. And truth be told, Liviu and I have our battle scars. We've had many implementations together, all of them successful. And I will say, I wish we had the AI tools of today. Back then, it would have made things, a heck of a lot easier. The advancements are just remarkable. So with that, what I'd like to do is set the context for today's discussion. As you can see by this slide sets a context of IT and cost optimization and AI. And Liviu, as we look at this slide in preparation for today's discussion, I'm sure we can all resonate what the messaging is behind this. Healthcare is in sort of a perfect storm, right? It's under siege. It's got shrinking margins, rising costs, workforce shortages, funding impacts, and evolving patient expectations. I find when I talk to my clients want more and more patient-centric solutions. If I had a quarter for every time someone said, I want to be the Amazon of healthcare, I would be a very rich person by now. But, up until today, it doesn't seem that we've had the ability to get there. What are your thoughts?
Great question, Janine. And for those who have spent many years in revenue cycle management or in healthcare industry, I think they all can relate to this. From my viewpoint on revenue cycle management, the challenges that we have here, for example, regulatory and policy shifts in insurance and patient coverage, labor constraints. These challenges are here forever. It seems like healthcare always was challenged by finding a solution for these challenges. It seems like year after year after year, you fix one and two are broken. You fix them, more are coming, like an endless cycle.
Yeah.
And it's like you start thinking, where is the solution? And that's exactly what I used to hear, and I hear from my previous clients as a consultant, is like, how come other industries can find solutions and your relationships, if you remember, to the Amazons of today's, to
I'm sorry.
no, to the airlines of today, it was 99% accuracy rate. And how can we reach that in healthcare? It seems like nobody had the answer. And I like to say that through this presentation, I believe in my, based on everything that I learned in healthcare, that healthcare is at the point where the right storm is coming in, where the solutions are finally coming to answer all those challenges.
Yeah, I mean the advent of AI, Gen AI, agentic AI have really changed everything. You know, the fundamental component that enables AI is data. So if we look at the right side of the screen, the synergy between the implementation, the data readiness, and the measured impact and cost effectivity is really important. Like healthcare has been collecting data 10, 20, 30, 40 years, but there's always been the question of what do we do with our data? How do we leverage our data? We have databases, we have data lakes. Now, with the way that cloud technology and AI has been able to come to the foreground, I think finally we are going to be able to bring these solutions to bear. I know I'm seeing it in some of my clients. There is a healthy skepticism, though. I would say there is a bit of fear, there is a bit of mistrust, and it has to be done responsibly. So guardrails are really, really important. So for our audience members, this session is going to outline how our clients are leveraging AI across the healthcare ecosystem, employed within a digital strategy that really will become your biggest advantage. It will help you to cost optimize, it will help you to do more with less, and most importantly, have a human in the loop. At Wipro, we do not believe that robots run everything. We believe that a human needs to be in the loop for responsible AI. So with that, I'd like to go to the next slide and talk about some benchmarks. So this slide really shows what a good organization looks like from a KPI perspective and what a great organization looks like from a KPI perspective. Liviu, how attainable are these industry best-in-class benchmarks? How common are these?
Janine, I would say that, and we'll, by the end of this presentation, we'll realize that are even more attainable that used to be 5 years, 10 years ago. And we're talking about a gap that is being filled by this AI automation. Again, we're not talking about human element replacement, our greatest asset, our employees. But we live in a country where the healthcare system is the most complex. While we have a lot of innovations, we have complexity brought up by the private industry, myriad of plans, with rules and regulation changes that you almost cannot keep up with the changes. Not only that, when you take in consideration the high turnover in revenue cycle and the amount of information that you need to learn in order to be able to process all these activities in the revenue cycle, you never catch up with it.
Yeah.
Having AI connect those and fill in that gap of knowledge from the history, from the regulations, for plans, and bring it together to an employee, to a human element in seconds. I believe that we are at the crossroads where healthcare can catch up with the Amazons of today's, the airline companies of today's, and live up not only to the standards, but also bypass them, going even further than this.
Liviu, I'm very excited to hear about the improvements in revenue cycle and have this discussion. Share with me the provider ecosystem. How, in your view, the provider ecosystem of the future.
More than happy. What you're seeing here is different levels within the revenue cycle management, what we call it the provider ecosystem. This is the interconnected structure that supports the full patient journey from the first point of contact all the way through payment resolution. And I think I don't need to mention that throughout the years, there are silos, and there are still silos and gaps between these levels within the healthcare. They do not communicate, they do not talk to each other. As you see, this is not just a set of operation. It's a strategic framework, one that brings together the patient access, the clinical coordination, the information integrity, and the financial performance, all into a seamless, intelligent system. At the top, under patient engagement, we begin with the new entry point into care, what we call the digital front door. And it's not just digital for the digital sake, so we find a catchy name. It's designed to deliver on-demand care. We all go back to on-demand cable and watch a movie whenever you want, the theme you want, when you want, meaning that in healthcare, that care is available anytime, anywhere, and on patient terms, wherever the patient wants, regardless of their generation or their tech comfort level.
Yeah, I mean, healthcare should be available as easily as it is to go buy a vacuum cleaner or to go food shopping or to do Instacart.
And this is the talk that we have for 20 plus years. What was missing is how do we get there? It seems like the never ending question, how do we get there? And we believe, and at Wipro believe that healthcare, again, it's at the crossroad where this can be accomplished through the technology of today. You know, if we are to consider, for example, let's think of, I'll call it John, a 72 years old Medicare patient that prefers to speak with someone on the phone. Or in contrast to Sophia, 24 years old, that's a graduate student who wants to handle everything by herself on her mobile app. Mm-hmm. Wipro enabled this frictionless access through AI-powered digital assistants, a real-time eligibility verification, an accurate cost estimation, and a digital prepayment. When questions arise, patient gets real-time through self-service tool or are routed based on the sentiment analysis that we'll talk about it maybe later to live and to a live, is transferred to a live empathetic agent who already knows, has all the information about the context of discussion up to that point. There's no repetition, there's no frustration on side of the patient. We'll see through all these functions from patient scheduling, registration, price transparency, digital assistance, financial assistance. All these are working together to create an intelligent, personalized, and on-demand experience. And this journey continues, doesn't stop here. As I said, it's the link between all these levers that makes this a success. As we go through care management, we ensure patients stay connected between visits. We support from population health, care coordination, case management, And all that information is available at any stage on this. Then we reach to HIM layer, where accurate data powers the back end. There are tools for EHR support, medical records retrieval, coding, and clinical documentation to ensure integrity and readiness for billing and compliance. And all this, as the patient moved through the chain, all this flows into the back end of revenue cycle, where you close the loop. We have claims and denial management to instant payments, credit balances and appeals workflows, and all we leverage automation AI to drive faster, cleaner, more efficient outcomes.
Yeah,
But
leave you some of these elements here, of course they need to be enabled. And, from the diagram here, the enablement is in these horizontal functions shown as the backbone. And obviously these all are costly. So I'm assuming that the added efficiency, additional patient volume, the collection of every dollar, the reduction in the cost to collect, the additional throughput is going to significantly help to fund some of these enabling layers shown below.
In fact, all these four horizontals are supporting the top sections of the revenue cycle. And this is the real value in how all these pieces come together. The four horizontal help forming a connected provider ecosystem that delivers what I called on-demand care across the continuum. Patient engagement and revenue cycle management are no longer separate. We need to start thinking, we need to act, and we need to treat them as interconnected levers, both critical to delivery care in a timely, transparent, and responsive to every patient expectation. Is that on-demand care that is flexible and can adapt itself to either a 24 years old tax-savvy or a 72 years old Medicare patient, to provide the information in a environment that the patient feels comfortable with. And as we look ahead, generative AI will take this even further, learns from every experience, and automates personalized communication, surfacing next best action. So next time, the patient experience will be even better, because generative AI is always learning and bringing up the best option. So we're not talking about just operations. We are building the entire infrastructure for a future of care that is intelligent, human-centered, and truly on demand. That's what we talk about provider ecosystem.
So I want to dive into the enabling horizontal layers, because this is critical strategic infrastructure that allows this ecosystem to come to bear and to actually show results. So the contact center spans across all functions. So it allows patient interaction across front, middle, and back office. And, with that intelligent contact center, taking advantage of, IVR and the intelligent agents, that is a game changer. The next enabling function is data and analytics, and we talked about this a little bit in the opening slide. Data is really key. The thing that I have learned about AI is, without data, there is no AI, right? Data is the basis for all of your AI learnings. So with all the data that we have collected throughout the years in healthcare, we have to make sure that this layer, this infrastructure, has the ability to fuel decision making, whether it's data in a cloud, data in a data lake. It has to be there has to be quality of data. There needs to be data governance, and it is an imperative to to enable AI. And of course, underneath that, we have platforms. We have our applications. We have, you have Azure, you have Epic, you have all of your applications. You have the infrastructure that it's hosted on, and we have cybersecurity. First and foremost, these applications need to be secure. The infrastructure needs to be secure and hardened, and it needs to be compliant because there is protected and sensitive data across every single touch point in this ecosystem. So a secure system is a resilient system. And then lastly, shared services. This is where we see our clients starting to have some real discussions now. How can we consolidate operations? How can we consolidate IT, HR, F&A, procurement, supply chain, so that we can, leverage our contracts, leverage our resources, have standard policies and procedures, and be able to add money to the bottom line. So these are very much enabling enablers for the AI of the future. So I think together, all of these will amplify the speed, the accuracy, and the scalability. Additionally, there's so much M&A activity in healthcare. The only way to really be able to scale quickly is with a model like this. I mean, I've seen this with our clients. We've seen lots of merger activity, and immediately they need to get value out of that merger. So, this is the way they will be able to do that. Let's advance, please. I know, Liviu, you are very excited about sharing the contact center of the future for a really incredible patient engagement. Please take us through the story.
More than happy to. I like to tell stories. So I like this to be, as I said, the story pretty much to match my Amazon story. You know how easy it is. And actually, it is a little bit too easy on Amazon, if you ask me. But let's imagine we are in 2025, and we are surrounded by advanced tools, apps, bots, and analytics. I mean, Microsoft is co-piloting everything. Google is Geminizing everything. We are chat GPTing everything. We are so surrounded by all these advanced tools, but in many cases, health systems still rely on manual processes. They rely on disconnected workflows, outdated communication methods across the revenue cycle chain. So I'd like to describe to you my vision of what revenue cycle should look like. And we'll go back to our two examples, our two patients. John, our 72 years old Medicare patient, just saw his primary care doctor, and he needs an MRI. He is confused, he is worried, not only because the reason why he needs to take an MRI and what may come up, the outcome, but also that cumbersome process of getting to get an MRI and getting through all the steps. So he doesn't understand his benefits fully. He isn't sure which imaging center to call, and he doesn't know when. And finally, when he decides to dial a number, he dreads that he's gonna be put on hold or he's not gonna be understood. But as he starts listening, he realizes something is different this time. John is greeted by an accent-neutral AI voice assistant, powered by a sentiment analysis that detects his confusion and responds with empathy. The system confirms his coverage, but the system answers is tailored on his confusion. So it has that extra, it provides that extra attention to his questions. The system helps him pick up an in-network provider close to home, schedule his MRI without transferring multiple times or without asking him the same question twice. And when John asks to speak with a live agent, he is immediately routed to the right human agent who is the full context preserved. He doesn't need to repeat anything. This is how it's done. This is how AI done right, with a human in the loop experience that is flexible, intelligent, and centered around the patient. In contrast, if we were to look at our patient, Sophie, our tech-savvy grad student, she doesn't want to have anything to do with that. She wants to pick up her phone, open her health app, follow up a recommendation, finds a diagnosis ultrasound where she can take it, checks her insurance benefit in the app, finds same-day appointment, everything at her fingerprints, and confirms everything with facial recognition and e-consent. Something that John wouldn't think about. She doesn't want to talk to a person. It's her preference. She just wants to do it on the phone, and she's done in less than a minute. But what brings these two together? Why, even though they seem so far apart, there is a commonality between them. It is that digitally reimagined revenue cycle that spans across patient access, eligibility, authorization, appointment coordination, all powered by AI, automation, and analytics. And this is the key. Having all these solutions that are tied together in unison and support each other without repetitive tasks or repetitive questions, all supporting the patient, clinicians, and doctors. So what will be the results? You'd see reduced administrative burden. You'll see claims paid on first pass resolution. You'll see a higher patient satisfaction. You'll see faster payment claims. Our AR will go down. And most importantly, this tailored experience, it's built that fits every patient, again, no matter their generation or their tech comfort.
We're at a really critical path at this point. Providers either have to get on board or they're going to be left by the wayside. This is really critical to be able to move forward successfully in such a competitive and turbulent environment. Everyone's competing for the same patients in these highly competitive markets. The clients that are able to embrace this and achieve this will be the ones that are the ones that are the most resilient.
And something I want to bring up that what you just stated, Janine, a few minutes ago, is that at Wipro, we are not replacing the human element.
Yeah.
And this is very important. We know there are, at least I'm aware of 2 states that have legislations that forbidding use 100% AI making the decision. It has to be a human element. This is important to Wipro because the Wipro way and strategy is that this reimagining the patient experience, not by replacing people with technology, but by using technology to empower people, empower patients, and empower our providers, our clinicians as well.
Yeah, absolutely. We are an AI first organization. So take us through what the benefits are. These are real benchmarks. They're measurable. They equate to significant dollars that can be saved and achieved in each of these vertical functions. Take us through a couple of examples across this value chain.
It is our experience, Janine, that once we have this provider ecosystem, the outcomes this transformation delivers are outstanding. Across the clients we support, the results are happening across the entire care and the entire revenue journey. When patient can self-schedule, they can verify their insurance. They can see cost estimates before a visit. We will see fewer cancellations, and we'll see a lot smoother intake process. When patients are informed and support upfront, they are more confident, more compliant, and even more satisfied. And think about when you talk about healthcare, how confusing is when you need a service, almost language that it's foreign language to you. That brought to a human level that you understand what you need and what will cost before you make the appointment. At the same time, the help that brings for the care teams, that they are able to act sooner with analytics identifying high-risk patients, prompting and also prompting timely intervention. This reduces readmissions and keep patients better connected with their care plan. And HIM and RCM, clean intake data translates to more accurate documentation and coding. This drives cleaner claims, fewer denials, and faster reimbursements. And most importantly, revenue cycle. When we get all the way to the end, revenue cycle teams finally start working together. With automation handling repetitive tasks and analytics, pinpointing where to focus and where to follow up. And because we engage patients early in the process, collections improve while bad debt goes down. And I would like to give us scenarios, for example, that happens so often. We have our coder going through pages and pages of documentation and history to understand why the claim was denied. And every time we have a claim denied, we have to go through that again and again, sometimes taking for 30 minutes to 2 hours of research before you can submit your appeal. Imagine having the AI follow you through the entire revenue cycle process. And in the digital front door, as you make decision and take data, having all that information from the history and saying, by the way, same scenario, same plan, same patient, we had this issue and this is how resolved, needs to be fixed, otherwise chances are for a denial. Or if it gets to a point where it was denied, having AI telling you this was the mistake that was done before and this how was fixed, and feeding that back to the front end so next time the patient doesn't repeat or the agent doesn't repeat that mistake. From 30 minutes to 2 hours, AI can take less than 30 seconds to provide you all that information. And this creates a patient loyalty. This creates more agile operation and definitely better financial performance because everything works in sync. Everything it's like a domino effect if it's feeding into the other one to a final clean claim submission.
Well, thank you for taking us through that. Let's take a look at the impact that the horizontal functions have on the vertical functions, and this is really very significant because this is going to drive success through your integrated service model, and this is depicting the synergies between the contact center, data and analytics, digital platform, and shared services. So what this slide is depicting is really the pivotal role and which horizontal functions really impact the vertical functions. So, success hinges on having the right technology infrastructure for the right service ecosystem, right? That's always the case. Across all the implementations I've done over many, many years, you need the right tech, the right infrastructure to support the right service and the right business imperatives. So what's always been a challenge is to be able to identify and prioritize which are the functions that are going to have the most impact, which are the must-haves, which are the nice-to-haves, which are the ones that are not needed. And that's essentially what red, yellow, green does here. The green is a way to have this view show a priority for the platform, the function that has the highest impact and efficiency on the outcome. So for example, digital front door, you need a platform for a digital front door, and that is key. If you look at yellow, yellow is an important contributor, but it's not an immediate priority. It's a nice to have, it's not a must have. So these functions support overall performance and should be addressed as resources allow, but it's not a must-have. And the red offers limited value and is not necessarily required for operational goals. But I'm sure as you look at this on, at a glance, this can be very helpful. Population health management, we need a data and analytics platform. For care management, you need a data and analytics platform. For remote patient monitoring, you need a telehealth platform for that, and you'll see that on the subsequent slide as well. So hopefully this will help you to prioritize what you have to do now, do next, and what is not necessarily needed. So let's advance to the next slide. And I know that during my time here at Wipro, we have a lot of questions about outsourcing because, of course, it's something that we do for our clients if that indeed is what they would like. So the first thing that I would like to be able to address with our audience today is some trends on outsourcing. So most recently, there's been a survey of healthcare executives. 90% of healthcare executives are exploring some type of cost savings by teaming with a third-party vendor for outsourcing. 54% of healthcare CFOs believe outsourcing will increase their efficiency and improve the organization's financial health. And, the same question, a similar question was asked to CFOs, which is, are you more concerned about the economic situation today than a year ago? And 70% of them said yes, they are much more concerned about the economic situation and the financial climate today than they were a year ago. And as far as physician groups with 10 or more practitioners, 68% of those outsource a combination of services, such as, claims and collections. So these statistics really do highlight the role that outsourcing is playing in the industry. It helps organization improve efficiency, reduce cost, and enhance operations. But again, there are lots and lots of questions about outsourcing. What is the value that outsourcing and adopting a shared service model? What value will that bring? So other than the survey elements that I just reviewed, a shared service model is a scalable platform that would allow hospitals and health systems to consolidate operations across facilities. With all the M&A activity that's happening in healthcare today, this really allows you to scale very, very quickly. And AI and the advanced technology is an integral part of that. Centralized technology infrastructure is a key element here. Standardized operations and best practices, which will allow you to reduce variation in administrative workflows and in care delivery. And cost optimization is a natural outcome of this. And lastly, you have an accelerated digital transformation across your individual functions that improve flexibility, streamline operations, help make, new working models much more scalable. The elephant in the room, though, with shared services and outsourcing is how is the market approaching this? How are health systems approaching this? There is, some fear, especially for first-time outsourcers. There is some hesitancy. So some of the things that we see in the market and that we do here is we encourage rebadging of staff. So if we rebadge your staff, that means that we are retaining the institutional knowledge. You're retaining your brand because we are rebadging your staff. We ensure there's an excellent cultural fit, and that cultural fit will drive excellence. You should not be able to detect the difference between a hospital employee and an outsourced employee because essentially they're all working for the same organization. We are all working for the health system, for our client. And centers of excellence bridge that gap in knowledge and culture. So the combination of AI and shared services together creates a foundation for intelligent, scalable, and future-ready delivery. And hospitals can, enhance their margins, increase, access, and improve outcomes, all while positioning yourself for some long-term success. So I know that we wanted to, think about where have we done this before? Where have we seen success? So these are 3 case studies that I'd like to point your attention to. We're going to share these with you. We have 3 different studies, 3 different types of organizations, a leading health system, a physician group, and a multi-specialty group, each with a different challenge, all interrelated, but each with a different challenge and a very excellent outcome. So we've broken this down by challenge, solution, and value. So we hope that you have the opportunity to review this and maybe be able to take some lessons learned back to your organization. Thank you, everyone. We appreciate your attendance.
Thank you, everyone.
Thank you. Have a great evening.